Let's talk about bridging the gap between theory and practice and why so many new nurses feel lost the moment they step out of the classroom and into the clinical settings. In nursing school, you spend a lot of time learning protocols, theories, and techniques. Everything from pharmacology to anatomy to ethical decision making. But here's the hard truth. Clinical settings are often messy, unpredictable, and full of variables you could never learn about in a textbook. Let's break this down. You've learned how to insert a catheter during a simulation, where the room is controlled, the environment is calm, and everything goes according to plan. But in the real world, your patient could be anxious, in pain, or unable to cooperate. Suddenly, that simple task become complicated. And the same skills that you mastered in the classroom don't feel so straightforward anymore. This disconnect is frustrating, and it's why many new nurses struggle when they transition from school to practice. And before you say classroom learning is meaningless, well, I have to say it is far from it. The key is learning how to adapt those principles to the reality of a clinical practice. And believe me, I have seen plenty new and student nurses fail at this task. It is something that you need to learn, so if you fail, well, that's just the first attempt in learning. Which means get back on the horse and try again. But let's start with understanding what your classroom learning actually provides. Theories, frameworks, and guidelines are the foundation of your nursing knowledge. Think of it like building a house. You need a strong foundation before you can construct anything else. Without a solid base, nothing stands up to the pressure. That is what your theoretical knowledge is. It's your safety net. The thing that gives you confidence in your clinical decisions. But here is where it gets tricky. No two patients are the same. You can't treat a diabetic patient with the same rigidity that you study in your textbooks. A 25-year-old diabetic who's well controlled will need different interventions than an 80-year-old with multiple comorbidities and poor compliance. This is where theory starts to show its limitations. Still, the theory gives you the framework to work from. You know the basics, like how insulin works, or what signs to watch for in hypoglycemia. The challenge comes in adjusting those textbook scenarios to meet the unique needs of each patient. And that's where clinical judgment comes into play. And you can learn much more about it in Kari Martinson's clinical theory. I will link it at the end. One of the most essential skills in nursing isn't something you memorize, it's something you develop: critical thinking. It's the bridge between theory and practice. In the classroom, you are taught how things should go. In the clinical setting, you learn how things actually go. Critical thinking is what helps you make sense of this gap and tie the textbooks to the clinical setting. Let's go back to our example of the diabetic patient. You've learned all about the glucose levels, insulin administration, and dietary restrictions. But what happens when your patient refuses to follow the diet plan? Or when they forget to take their insulin because of cognitive decline? Your textbooks might not have all the answers for those situations, but your critical thinking skills will guide you to ask the right questions and make the right choices for your patient. Here's something to consider, especially if you are a student nurse or if you're teaching student nurses. Well, in the classroom, there's often a right answer. On the clinical floor, there's not always one perfect solution. Your job is to use your theoretical knowledge as a starting point, but adapt, adjust, and critically think your way through each unique scenario. The more you hone that skill, the better you'll become at bridging the gap between what you learned and what you experienced. And a great way to do that is actually to run scenarios with your colleagues. It's a professional sparring method. Take a scenario, run it through with your colleagues. Say, what can we learn from it? What can we do? Take in all those ideas that they have. And let's jump to something I have done both in nursing school and after nursing school. simulation labs. Because simulation labs were designed to be the middle ground between theory and practice. They give you a chance to apply your knowledge in a controlled environment that mimics real-life scenarios. But here's the catch. While simulation labs helps you build confidence, they still don't fully prepare you for the unpredictability of the clinical settings. In the lab, everything goes according to plan, or at least according to the teacher's plan. You might practice managing a cardiac arrest with a mannequin, and the simulation follows the steps as you've been taught. You call for help, initiate CPR, administer medication, and the patient responds accordingly. But in real-life scenarios, there might be 20 other things going on around you. Family members are panicking, equipment malfunctions, and your patient doesn't respond to the intervention as quickly as you would expect. The value of simulations isn't to replicate real life exactly. It's about teaching you the process and protocols so that when the chaos hits, you can fall back on what you know while adapting to the situation. Because no amount of classroom learning can replace the wisdom that comes from hands-on experience and mentorship. One of the biggest challenges for new nurses is that they are expected to jump into the clinical practice with very little transitioning time. In many cases, the new nurse are paired with a senior nurse. But for some departments, that senior nurse has only been there for 6 to 12 months because there's too much of a change in personnel. So that makes that transition from student to practitioner so overwhelming. And that's why we need good mentorship. A good mentor helps you bridge that gap between theory and practice. Not by giving you all the answers, but by guiding you through the thought processes behind clinical decisions. A mentor shows you how to adapt classroom knowledge to the real world, helping you build confidence in your abilities. For example, let's say you're dealing with a post-operative patient who suddenly becomes tachycardic. You've learned in the classroom that this could be indication of a number of issues, hypovolemia, pain, or even sepsis. But your mentor helps you dig deeper. They guide you to assess the patient holistically. Look for subtle signs and prioritize interventions over time. These experiences help you develop your clinical judgment so you can think on your feet. So nursing school teaches you procedures, protocols and guidelines. But what it doesn't always teach you is flexibility. In the real world, flexibility is one of the most valuable skills you can have. You need to be able to pivot quickly, adapt to unexpected situations, and sometimes make decisions based on incomplete information. Take the example of a shift in the emergency department. You might have planned for how you are going to handle your patients, but as soon as an unstable trauma patient comes through the door, that plan goes out the window. You are forced to prioritize, delegate, and shift your focus immediately. Here's where your classroom learning comes into play. Even though the situation has changed, you still have the foundation you learned in school to guide your actions. You know your ABCs, airways, breathing, circulation, and you know how to assess for immediate life-threatening conditions. Flexibility means being able to rely on those theoretical foundations while adapting to the situation in front of you. And with that in mind, we are led to something every nurse eventually learns. Your education doesn't stop when you leave the classroom. Bridging theory and practice is a continuous process that evolves throughout your career. Each shift, each patient, and each new experience adds to your knowledge base, and that is one of the most important lessons. Nursing is a profession of lifelong learning. You will encounter situations that challenge what you've learned, and sometimes the best course of action will go against what the textbook says. That doesn't mean your classroom learning was wrong. It means you are learning to adapt that knowledge to meet the needs of your patients. Let's say you've always followed strict guidelines for infection control, but then you encounter a patient with unique cultural needs that requires you to modify that standard protocol. Well, you don't throw out what you've learned. Instead, you adapt it. The ability to continuously learn, adapt and grow is what makes a great nurse. And one of the tools is one of the most underappreciated aspects of nursing. It is the power of reflection. After every shift, take a moment to think about how you applied your theoretical knowledge in practice. What went well? What could you have done differently? Reflection is where the real learning happens. It's where you connect the dots between what you've been taught and how it plays out in the real world. As you reflect, you start to see patterns. You recognize which interventions worked and which didn't. You learn how to communicate more effectively with patients and colleagues. And most importantly, you grow in confidence. Over time, the gap between theory and practice starts to close as your clinical judgment sharpens and your decision making becomes second nature. And one of the ways you can sharpen your knowledge is with Gary Martinson's theory right there. And yeah, I will check it out once more because you can never get too much of Gary Martinson's theory. So I'll be seeing you over there.